not yet hospitalized, but that are at risk of progressing to severe disease. And then there are also these data that have been emerging from the recovery study in the hospitalized setting, which indeed are quite important data. So now we will be assessing all this data, starting from the studies in the outpatient setting and the post-exposure prophylaxis, and then we will see by when it will be possible to start granting marketing authorization, which we would expect would happen for sure before the end of the year or even earlier.
Thank you very much. We now have one remaining question, so everyone who still wants to ask a question should raise their hands. So the last question for now comes from João Guerreiro from Portuguese Radio Notícias. João, please.
Hello, Mr. Cavaleri. I would like to hear you on a possible update on Janssen vaccine. And if you are aware that in Portugal, there are reports of groups of people fainting after being vaccinated with the specific batch of Janssen vaccine, and if EMA has similar reports from other parts of the EU.
Thank you very much. I'm going to give this question to Dr. Genov. Dr. Genov, please.
Okay, now we obviously, as for all vaccines, we closely monitor all new emerging safety information. I'm not aware of specifically of this cluster of events in Portugal, but we will, of course, look into details. It's not unusual in young people to have described side effects of syncope or fainting, so it might well represent a well-described side effect, but certainly something we will look into. Thank you.
Thank you very much. We have another question from Ulrike Bartholomeus. Ulrike, please.
Yes, hello. I have a question also concerning CureVac. As you said, Dr. Cavaleri, you do not expect that the company will submit all the data by the end of the summer. Are there already did you already ask some questions to CureVac that they will answer, or did they not yet submit all the data from the Herald trial?
Thank you very much. Dr. Cavaleri, please.
Yeah, I think what I can say is that the agreement with the company is that all these data are collected, so we have good granularity on all the clinical evidence that is coming from the Herald study, including additional analysis such as immunogenicity, and then all this data will be submitted for review by the EMA so that we will have a comprehensive overview of what this study is telling us. And after that, we will see if we have additional questions for clarification, as we normally do, and we will see what will be the next steps.
Thank you very much. The last question now comes from Kiran Randava from Good Morning Britain. Kiran, please.
Hello, sorry, can you hear me?
Yes, we can hear you.
Right. Sorry, apologies if you've already covered this. I missed the first couple of minutes of the meeting, but could you please give an update on the Indian-made version of AstraZeneca, Covishield, and where is this in terms of being approved?
Thank you very much. Dr. Sweeney, please.
Yeah, so thank you, and perhaps if I could understand that this is being asked in the context of the recognition of different vaccines for purposes of travel between member states or into the EU. So the first thing to emphasize is that the recognition of vaccines for that purpose is the role of the European Commission and the member states. And indeed, the European Commission has good information on its website, and if I may quote from that, I think we can share the link. It says, among other things, that member states have the option to also accept vaccination certificates issued in relation to vaccines that have been authorized at national level or by the World Health Organization. The role of the European Medicines Agency, by contrast, is to evaluate marketing authorization applications for vaccines for authorization and use in vaccination campaigns within the European Union in member states. And I can say that for the particular vaccine, Covishield, we have not received a marketing authorization application at this point. And you will know if we do in the future. Thank you.
Thank you very much. So I'm now closing today's press briefing. Thank you very much for your attention. And a big thank you to my colleagues who participated today. And if you have any further questions, please do not hesitate to follow up with the press office or check our website. And you know our email address, press@ema.europa.eu. So thank you very much and have a good afternoon. Bye-bye.